And here's the thing. Can we really expect 15 million people to stay indoors for the next half a year? So that's the over 65 age group, okay, broken down, over 65 age group, 11.9 million people aged over 65, 3.2 million people aged over 80. You don't get these facts anywhere. You wouldn't get this on Radio 4, would you? 1.6 million people aged over 85 in the UK. That's by age. There's vulnerabilities that you could throw in there as well. If you looked at the whole gamut in this respect, 15 million people to shield for half a year. Are you serious? Man alive, what is happening here? This is the issue that is foremost at the moment. Hundreds of thousands of vulnerable Brits may be expected to shield indoors for months, and measures to curb coronavirus will be likely to last until at least April to stop the NHS imploding as winter looms. Advice for clinically at-risk people to avoid contact with others could be included in the top tier of the traffic light system on the local lockdown, which is set to be announced next week. Concern is mounting over rising infection rates, particularly in the north of England. In the country overall, 609 patients were admitted to hospital on Thursday. That's an increase of a fifth in one day. And a further 17,540 cases reported, 77 deaths. The number of patients in intensive care in parts of the north could overtake April's peak within 3 weeks. This is England's chief medical officer, Professor Chris Whitty. He's back. He held a private meeting with MPs from those constituencies in the worst affected areas in the north. One MP who attended the meeting said the number of people on ventilators is going up alarmingly fast in those parts of the country. If this continues, then you get to a point when the health service is placed under significant strain. Interesting report out today said the majority of Brits favour a tougher lockdown. That was a poll for one newspaper. I'm not sure what we specifically read into that, but where do you sit? In the last hour, some news from the ONS. Coronavirus cases in England have increased rapidly, with 1 in 240 people infected. I sort of bolted at that story. 1 in 240. The figure comes as the government, of course, grapples to introduce new restrictions. Science advisors warn hospital admissions are very close to the levels of early March. Ministers say cases are getting out of control. The ONS estimates, which go up to October the 1st, that 17,200 people a day are being infected in homes in England, with the highest rises in the North East, North West, Yorkshire and the Humber. The organisation estimates that 1 in 500 people in infected areas in Wales and Northern Ireland. This is the COVID Symptoms Study app, which uses data from 4 million people and 12,000 swab tests. Estimated 21,000 people are developing COVID symptoms every day across the UK. That's 1,000 a day more than a week ago. COVID symptoms and COVID, two slightly different things. We'll crunch those numbers a little later on. What I'm intrigued is the headline here about shielding. And we've talked about damage and the knock-on effect of the lockdown and whether that damage is far greater than the virus itself. We've spoken to epidemiologists and all manner of people involved in this area who've been quite unequivocal, very honest, even to the point where they've been criticised by others in their peer group, that this is something that will eventually create a greater turmoil because of the lockdown. Now, I appreciate the room divides on this, and I get it, but that doesn't stop the reality that in terms of people not getting hospital treatment, in terms of, can you imagine if you're in that situation? I'd like to speak with you this afternoon on this. If this is either your own story or somebody in your family's story. So if you've got somebody who's over 70 with an underlying health condition, okay, they're vulnerable or susceptible to something that could mean that if COVID came rushing around the corner, they'd be like a sponge, they'd be one of the first to pick it up. Those people would have been shielding since March and maybe recently came out of shielding. Some, because they're careful, would have remained in that position. You'd be asking those people potentially to do another 6 or 7 months. So a year in isolation. You can commit several very bad, violent offences and not get a year in isolation. You can wave at your grandkids through the glass. Great. You can go and see mum and leave some soup at the front door. Fantastic. Can you even begin to imagine the kind of damage this would cause? A friend of mine who wasn't shielding, but just very much lives on his own, so he adhered absolutely to the rules and the regulations of staying indoors, and he was working from home, so it was fine. But he said, I began to realise why solitary confinement is a punishment. There's a point when you say, oh, this is rather good. I can make this work. I've got my box sets to watch in the evening. I have a beer as well. It's rather nice. There's no rush hour involved. There's no big crowds out there. I can make this work rather nicely. And it was fine, he said, for probably 3 weeks. He thought it was fine. And there was a kind of a bit of a tipping point. We thought, actually, I'd quite like some human contact here. And he nipped to the supermarket. You see a few people, but it's all very in-out situation by definition of what was going on. And then he's back home again, another couple of weeks, seeing nobody at all. He said literally after 6 weeks, he thought he was going to pull his hair out. And then 7 weeks, 8 weeks, 9 weeks. And imagine if you're in that situation. You're an elderly person. You perhaps already have issues as a solitary-based existence. And you don't see many people even on a good day. And you're told that in addition to all of the isolating you've done, you are going to have to isolate for another 6 or 7 months. I honestly don't know if that is doable without the most disastrous kind of damage for those people involved. 0344 499 1000. If that is your story, if you are one of those people, or whether it's your nan or your parents and somebody in your family in that position, how do you even begin to imagine coping? Because there's a point, and I can remember this at the beginning of lockdown, I can't have been alone, when we heard about these lockdown things happening around the world. Do you remember that? And it's sort of it's not going to affect us, is it? We didn't really have any stats. I go back to that email I received from somebody saying, why are we panicking? Only 39 people have done. 39. I should have kept that email because it was incredible to read that. And I remember thinking, yeah, he's got a point. 39 people. Look over there in France and Spain and Italy. It's all going absolutely pear-shaped. 39 in this country. Not bad at all. We'll be all right. It seemed a complete misnomer in the discussion that we would have a lockdown. I'm talking to parents at the school gate on this very point. Are the schools going to lock down, somebody said. I thought there's always some chancer, isn't there, in the crowd that starts a rumour. Are the schools going to lock down? As if they're going to shut the schools. Or a parent saying, well, I might take my kid out of school now. People were terrified. I think, what are you talking about? Schools aren't going to close. 3 weeks later, the schools closed. The place locked down. Nobody went to work. We had our 3 months thereabouts of, well, simply staying at home. It was horrible. It was horrible. So what seems now, surely not again, this can't happen. If we follow this data, this is absolutely the path the government are going to take. This time next week, when Boris Johnson makes those announcements, we could be in that place. Now, okay, I don't know if it's going to affect all 15 million people over 65, but certainly we know the health advice is the elderly. Not that I think 65 is particularly old, but you take my point, the elderly and the vulnerable. Could we really expect 15 million people to stay indoors for half a year? Could we expect anyone to stay indoors for half a year for that matter? 0344 499 1000. This might be where we end up. According to the ONS, 1 in 240 people in England, this is, so these are not the stats for everywhere, are infected. Now, there's a part of me that looks at that and thinks, well, that's surely going in the right direction. Because the more people that are infected in this respect, clearly you begin to bring the numbers down. Herd immunity plays its part, but the concern in this is that hospital admissions are going up as well. Where does that sit? It's almost kind of the reverse of what we discussed yesterday. If hospital admissions go up to that point, then what choice do we have than to explore the potentials of another lockdown? But I just can't see in reality how you can ask that amount of people to shield again. No contact, not a cuddle, not a handshake, nothing at all. You'd be lucky to get a glance through your patio windows at your own grandkids. 0344 499 1000. Serious question. Is that doable? Could we really ask that of anybody again?